turn it in down here at the corner. Thank you. Mm-hmm. Yep. And board members, thank you, Jeff. All right. Before we start, I'm going to make a brief comment. On August 18th, an open Board of Education meeting was held. On the agenda was approval of the back to school plan. Every community member who indicated they wished to speak did. They expressed several perspectives on this issue. Our goal, just like yours, is for the school to be open and to be a safe place for our students and staff. At that meeting, the majority of the Board of Education felt that the universal indoor masking was the best way to accomplish that safety. Thus, they did approve the amendment to the proposed back-to-school plan. Many people who were not at the meeting have now expressed an interest that they too want to address the board regarding this issue. So, we have called this special board meeting. And I have a stack of people who wish to speak. The issue before us tonight is basically how to keep the school open and safe for our school community. It seems like there are some very different ideas on how this can be done. Essentially two. And these are the two issues that will probably come up tonight. But they are indeed both aspects of the same goal. Some of you will speak about who gets to decide how to keep our entire school safe. Should the school decide for all students, or should the choice be left up to the individual families? Others will discuss the science of disease prevention. Should these decisions be made based upon the preponderance of scientific and medical evidence, or the writings of a small dissenting group? The board will listen to public comments. We will revisit the masking requirements in our back-to-school plan, and we will vote on whether to change this plan or not. It is the duty of us as your Board of Education to represent all of the people in this community. In order to do that, it is our goal to provide the best and safest school environment we can for all of our students. So just a reminder, I do have, like I said, a decent stack of requests of people wishing to speak. You will be recognized by me and requested to preface your comments by an announcement of your name. Each statement shall be limited to 3 minutes. Our policies and the form you filled out states 5. That is for a regular meeting. In a special meeting, we are able to reduce that time if need be. No participant may speak more than once on the same topic unless all others who wish to speak on that topic have been heard. Participants shall direct all comments to the board, not to any staff or other participants here. All statements should be directed to me. No person is to address or question board members individually. And with that, okay, if there is anybody still wanting to turn in a form, please do so. If not, we will invite our Yvonne Rands to be our first speaker. Please come down to the microphone at the podium, please.
Hear me now? I have to sit real close. How's that?
Just barely.
Oh, can't you hear me like this? Okay.
Okay, go ahead.
My name is Yvonne Rands, and first of all, thank you for reconvening to hear additional information from us constituents who chose you to represent us on the board for our children's school. We are here to share our perspectives. Thank you, too, for giving additional consideration, in particular, to the masking aspect of the back-to-school policy. Any policy adopted must comply to legal guidelines and should consider current data. The back-to-school policy that was created by input of many and initially proposed to the school board by our superintendent did both. CDC guidelines were considered and incorporated. According to the most recent CDC publication on August 5th, 2021, masks were recommended when indoors and in general do not need to be worn when outdoors. Also, on August 3rd, 2021, our governor said he has no plans to issue another statewide mask mandate, that we as a society have to decide. Masks have benefits. Masks have consequences. Masks made of the highest quality material and the best design that are worn correctly and handled correctly would be the most effective in limiting any transmission of the COVID-19 virus aerosol particles. But how likely is it that all these aspects are being accomplished? Are all the masks made of the right material? Are all the masks the right design? Do all the students put them on correctly? Are all students handling the masks correctly? With so many variables, how beneficial are they? Do they actually become a liability? Could their mishandling actually spread the virus? What are the consequences of wearing a mask? There are physiologic, psychologic, and sociologic implications. Elevated carbon dioxide levels from rebreathing air from inside the mask causes increased respiratory rates, increased mouth and blood acidity, and activates the firing of the hippocampus amygdala region of our brain, which is the fight or flight response. This in turn makes learning more difficult. Masks also lead to more social isolation, which in turn can lead to higher levels of depression and other mental health issues. Masks have also been known to cause headaches, voice complications, and facial acne. How does this affect the student's self-esteem and cause time away from school for medical appointments? Humans have more facial expressions than any other species. Most of the mimetic muscles are below the eyes. By covering over half of the face, full communications, including facial expressions and lip reading, is hindered. Thus, so is learning. And how prepared is our school district to handle these mental health crises? With the addition of masks, how much information is lost in determining the mental health of a student based on their body language? Just 3 years ago, our school had a crisis that was a surprise to many and went undetected by many. Masks weren't even being worn then.
Mrs. Rands,
Considering,
your 3 minutes is up.
okay. I just asked that you would reverse the decision and implement a mask optional policy, and I thank you for your time.
Thank you. Okay, Ron Freeman, please.
My name is Ron Freeman, and last board meeting, I came before you to give you numbers. Tonight, I come back with additional numbers. The facts that I gave were from a German study that hopefully, if I have enough time, I'll get back to. Do mask mandates work? Well, let's look at what happened in Wisconsin a year ago. A year ago, Governor Evers put on a mask mandate when cases were about 900 to 1,000 cases. And in 3 months, those cases went up over 7,000 to almost 8,000 a day. Do mask mandates work? I'll leave it to you to determine that. Emily Oster, a Brown University professor, did some studies from high schools last year, during the last school year. And she had 6 million who were in-person students. And in areas of high community transmission, masked school students saw a case rate defined here as daily cases per 100,000, 37% higher than non-masked school students, or 19 cases per 100,000 in no masks required schools versus 26 in mask required schools. Even worse, staff experienced a case rate 84% worse in mask schools at 19 cases per 100,000 in no mask required schools versus 35 in mask required schools. In areas of lower substantial community transmission, students experienced no difference in case rates, while staff numbers in mask required schools were slightly worse. And in Germany, the effects of masks that I cataloged last time were given to a German court, and that German court told the schools to get rid of the mask mandate because of the health problems that were there because of the mask mandate. And in Sweden, they did a study of mask wearing, or they actually didn't do mask wearing at all in the schools. And what they found was there was no difference in risk of serious COVID disease. The parents whose children kept going to school were slightly more likely to test positive for COVID, but no more likely to be treated or hospitalized for it than the parents whose children stayed home. So I also would like to have you reverse your decision and make masks optional.
Thank you. Okay, Marcia Fine.
I don't think you heard Todd.
Now, I do know that many of you agree with the speakers, and they certainly will appreciate your applause, but could you try to keep it as brief as absolutely necessary, because all it does is take up somebody else's time. So thank you. Marcia.
Thank you for this opportunity for us to speak. My name is Marcia Fye. I will begin by saying that all I know about the current controversy over the mask mandate in our school is what I read in the August 26 Ladysmith News. I read that much research has been done by board members. I was curious about their sources. I then read that one member, after being asked about sources, remarked, "If it comes from Johns Hopkins, you can take it to the bank. If you are hearing it from Fox News, you can't." Well, it just so happens that I did come across this comment from Dr. Martin Makary, surgeon at Johns Hopkins Hospital and professor at Johns Hopkins University School of Medicine. Quote, "We've imposed a tremendous amount of restrictions on 50 million kids. I can't believe it's now coming on 2 years when we ask them to cover their faces and give up their livelihoods on real flimsy data. A tremendous toll on kids' mental health or development, on nutrition, and these other things discounted when we focus only on cases and transmission." End quote. I then found a list of 47 studies indicating minimal effectiveness of masks. The following are quotes from 3 studies conducted by the National Institutes of Health, a government agency. One concluded, there was, quote, no statistically significant difference in infection rates between the masked and unmasked, end quote. Another, quote, cloth masks are only marginally beneficial in protecting individuals from particles less than 2.5 microns, end quote. COVID particles are 0.125 microns. Another, quote, the use of face masks, either by infected or non-infected persons, does not have a significant effect on influenza transmission, end quote. I include a list of risks associated with prolonged mask wearing, some of which were reported in a study by the University of Louisville. Reduced blood oxygen levels after only 1 hour, adverse skin reactions, yeast infections in the mouth, inflammation of gums, cavities, bacterial and fungal infections in and around the mouth, tension headaches, allergies, decreased cognitive precision, interference with social learning in children, distortion of verbal speech, and removal of visual cues. These opinions are available, but you have to look for them.
Ma'am, your time is up.
May I have 2 more seconds? You might want to ask yourself, why is that? And you might have to use a browser other than Google.
Thank you, Marcia. Ray Palumbo. Ray Palumbo. Okay. Rachel Rance.
By now, I think that you guys have heard everything. There really isn't much more that needs to be said. Anyone in their right mind listening to the audience would surely vote for masks optional. However, my only concern is that there may be some board members who already have their decision made based on personal opinion and are too stubborn to budge. So I'm here to make sure we're all on the same page. I truly believe that each one of you has positive, amazing intentions and believe that forcing masks would really benefit everyone. You are wrong, and that's okay. But now we have an opportunity to correct that issue. I'm not a parent, I'm not a student, I don't even live in Ladysmith half the year. But what I can tell you is that even though I'm not extremely involved, I spend a heck of a lot more time around these students than any of the board members that voted to force masks. You are so far removed from the situation that you cannot vote from your own opinion on this because you're not even involved. And that's okay that you're not involved and don't have kids in this school. But because you're not involved, you should have listened to the people on the front line, like the coaches, the teachers, your school nurse, your superintendent, perhaps the community and the parents. Hello. You're supposed to vote in the best interest of our school. You don't even know what that is without listening to them. And you disregarded all of that. You didn't even care. My personal opinion is that masks are useless, but you better believe that if I was one of you on the board right now, and the majority of the people wanted to force masks upon our students, I'd humbly set aside my opinions and beliefs and represent and listen to the community. Why? Because that's my duty. It is not your duty to vote based on your personal belief, opinion, or political standings. It's your duty to vote based on and represent the community. You failed to do that last Wednesday. Do not fail again. So let's take a quick poll. City of Ladysmith, stand up if you are in favor of having mandatory masks. Go ahead, stand up.
Rachel, you're not allowed to address the audience.
Okay. Well, look around you.
But thank you for those who wanted to stand up.
I'm choosing to speak today and give those a voice, but if they can't have one, then I'll have it for them. These are the people. Look at these people all here today that voted you in, they can also vote you out, so listen to them. During your revote today, if your vote is still to enforce masks upon the student body, then it's clear that you truly do not care about the best interest of the district, and instead you only care about being in power, being right, and pushing your personal views on everyone else. It then is also clear that you do not belong on this board. I hope that you change your mind.
Derek Jochimson. Derek. Derek Jochimson.
My name is Derek Jochimson, and it's too bad I have to follow that one up. But I have 4 kids in the Ladysmith School District. I was a member of the task force, and I'm just here tonight asking you to listen. I was also in attendance at the school board meeting last week where the school nurse gave observational evidence of how these kids wear masks. There's debate on the efficacy of masks. Some research says they might help. There's a lot of research that says that they don't do anything. A lot of research shows that most adults don't wear them properly, let alone kids. There are drawbacks to masks. To do anything other than making it optional is stripping parents of their right to choose what's best for their children. Please reverse the mandate. Thank you.
Thank you. Trinity.
I thank you all here. Can you hear me? Yes. All right. I thank you all here for coming here and listening to our opinions and our facts.
Trinity, could you give us your last name real quick?
My name is Trinity Cleaver.
Okay, I wasn't sure. Thank you.
All right. So again, I thank you for coming here and listening to our opinions and our facts. Your willingness to listen is much appreciated. Both Bruce and Flambeau have considered making masks optional. They agreed with this, then they implemented it. And so far, it's been working. If someone is completely concerned or worried or frightened about contracting this virus, they should have the option to wear a mask, and they should have an option to do what they feel will make themselves safer and make the decision for their families. But it should not be forced upon us. That is not right. That is not morally right. It is up to the families, the students, and the staff here at this high school to make that decision for themselves. I personally do not feel any safer wearing a mask, and I can only speak for the rest of this public saying that I'm assuming that many don't. Many feel the same way. We must listen to our public, and as you can see here tonight, it's saying that it should be optional. And your opinion should not be a factor in this decision, and it should be up to the students, their families, and the staff of this high school to make the decision that they feel is best. Thank you.
Thank you. Bob Hauser.
My name is Bob Hauser. Can everybody hear me okay?
Yes.
I was at the meeting here a couple weeks ago where we went over the back to school plan. I thought it was adequate being optional instead of mandated. I felt we had some protections in place for our children. I felt we could all work together. I was glad that we had some options for our kids. Our parents could make some choices in our children's well-being. Our older kids could decide for themselves if they wanted to wear a mask or not. It upset me when I heard that that decision had been changed and that flexibility was gone. I hope that tonight, based on everyone's comments, that you will revisit that and change that decision for giving our parents and our kids some better choices, and they can decide what's best, what fits their needs, and take care of their health the way that they see fit. Thank you.
Thank you, Bob. Jim Kurz.
Jim Kurz, that's my name. I was listening to NPR radio yesterday morning, and I heard some disturbing news from Mississippi. A little closer than Sweden and Germany, but still quite a ways from Ladysmith, I understand. But other schools have already had experience with the Delta variant of the COVID-19. From this report yesterday morning, they interviewed Hagen Barber, the lead nurse for the Lamar County Public Schools in Mississippi. Ms. Barber stated that they started school on July 22nd, about a month ago, without a mask mandate. They had to quarantine whole classes because 2 or 3 of the kids had the COVID-19, and they didn't want to, and they had already been close to the other kids in the class. They had to quarantine the whole class. This was without a mask mandate. I don't know if I said that. Within 2.5 weeks, they closed all the schools and restarted with a mask mandate. Ms. Barber mentioned that last year kids were hardly affected unless they were quarantined due to family COVID-19. In the class, they had very little problem other than having to be quarantined. But she said that the Delta variant that is coming through the country now is, I quote, unbelievably potent, transmits so fast, and a whole different ballgame compared to the Alpha strain of last year. 6 children have died from COVID-19 in Mississippi. 1 less than 5 years old. Lamar County in Mississippi are 44% vaccinated. Russ County, that was 2 days ago, I got the data. Russ County was 36% vaccinated. So they were more vaccinated than we were. And I'm saying that they had a problem. It's a variant that most of us are not familiar with. And we could have it worse with our lower amount of vaccination here in Russ County. I know a lot of you don't want to hear that, but I know most of the people on the school board here, and they do care. I'm sure they care. And they have more responsibility than most everybody else. Thank you.
Thank you, Jim. Timothy Jerry.
Good evening. My name is Timothy Jerry. I want to thank the board again for reconsidering this issue and hearing the people of your district. I think one of the questions we have to consider when it comes to the masks is where does our freedom come in with wearing of masks? Masks have been very divisive since they were issued. You know, if I truly believed, if the evidence was just overwhelming that masks were effective, I would be a strong advocate of masks. But masks, like everything else, has been one contradiction after another. And numerous studies show that masks are completely ineffective in stopping COVID-19 because of the size of COVID-19. Studies have come out, the CDC itself says on its website that masks are ineffective, surgical masks, in stopping smoke particles. And we know that the aerosol that causes transmissions of viruses is so much smaller than smoke particles. Some doctors and experts have said it's the equivalent of putting up a chain link fence to stop mosquitoes from coming into your yard. So if masks worked, I would be an advocate of masks, but they simply do not work. And the consequence of wearing masks, I think, has not only psychological consequences that we've heard, they have health consequences because of the prolonged exposure to carbon dioxide and other bacteria and health issues that children are exposed to. We know who is affected by COVID. It is the elderly, people with pre-existing conditions. Study after study has proven that children have a very low risk of COVID, and they're not substantial transmitters of COVID. So the notion that we should mask children to protect them from COVID-19 is somewhat of a contradiction. I think we should realize that people need to have choice. I'm questioning when this is ever going to end. Are we going to be wearing masks next year? Are we going to never stop living our lives normally? Are we going to continually be perpetually inundated with the idea that there's a deadly virus that's going to kill us all? More people die from other things in this country than COVID. Their suicides are through the roof and other mental health issues because of what has happened with lockdowns, with mask mandates, and government interference in our lives. Again, I thank you guys for taking the consideration of your parents and concerned citizens, but I think this should be left up to parents, not to government. And I really would ask you to change your position on this. Thank you.
Thank you, Tim. Okay, Jack West.
Good evening, members of the board. My name is Jack West, and I am this year's student body president here at Ladysmith High School. On behalf of my fellow students present here tonight, I can confidently say that we are most definitely not in favor of a mask required policy for this school year. Many of us here at LHS are not just kids. We are young adults who are beginning to make decisions for ourselves in our own lives. As students, we believe that our opinions and beliefs should be represented and thoroughly considered. After all, we will be affected by the decision made here tonight. As president of the student body, many students have demonstrated to me their opposition to the mask mandate. Not one student has approached me with concerns about their health or safety, nor has anyone expressed to me their desire to have face masks mandated in our school. The overwhelming majority of us are in full support of the mask optional policy set forth by the district administration. As students, we ask that you please consider us when you vote this evening. Thank you.
Thank you, Jack. Karen Welke. Karen.
Good evening. My name is Karen Welke, and I thank you for having this special meeting so we can express some of the concerns we have as parents and taxpayers. I have multiple students in the district, and last year I did keep them at home. I kept them at home after they requested not to go to school because of masks and chaos and whatnot. And they were very excited to return to school this year, including a new student, a four-year-old kindergarten student. A student that has spent much of her young childhood in the hospital. And if anyone should have anything to say about concern over health and whatnot, it should be a parent who has spent many nights in the ICU with a child. But that child has a collapsing trachea that when forced to cover her mouth and force breath through an additional layer, struggles, gets infections, coughs. As a parent, it should be my choice, along with my child's healthcare provider, to decide whether that child needs to be masked or not. I do not feel that that is the board's decision to make. You are supposed to represent the people of this community, and the people have spoken. The people have let you know how they feel and their concerns. And as representatives, it is your duty to represent that. I would ask that you reconsider the mask mandate policy because you are not my child's doctor. You are not their parent, and that decision should remain with the parent and the healthcare provider alone. Thank you.
Okay, again, Ray Palumbo. Ray? Okay. That then completes all the requests to speak.
Yeah, it's Ray Palumbo.
Okay. Okay, Chrissy, you want to hand that to me back? Put it in the stack. Okay, I do want to thank all of you who spoke, and we appreciate that. We will now move on to the next item on the agenda, which is the reconsideration of the back-to-school plan. Mhm.
Motion to amend. Sorry about that. Motion to amend the back-to-school plan. Recommended action. Let's see. Move to amend the back-to-school plan as follows. The School District of Ladysmith will follow the recommendations of the Wisconsin Department of Health, the Wisconsin DPI, the Russ County Health Department, the CDC, and the American Academy of Pediatrics. We recommend that all eligible students, teachers, and staff should get vaccinated against COVID-19 to protect themselves and others in the school and community. We recommend that regardless of vaccination status, all students, teachers, and staff should wear face masks at school. The Board of Education and school administration will review this data regularly to determine if changes in the mask requirement are necessary based upon community transmission and infection rates. This plan is subject to change as we address the safety of our staff and students during the 2021-2022 school year.
We have a motion. Do we have a second?
I'll second.
We have a motion and a second. This plan is written basically and even takes much of the wording from the Wisconsin DHS guidance on schools. It does recommend that everyone in the school should get vaccinated. And it does recommend that everybody, students, teachers, staff, should wear masks. Comments, questions? Should means should. Should does not mean required. Should means should, it is not required. If it were required, it would say required.
So you're saying that this plan is optional for masks?
It does not require masks. I will say that I was disappointed to hear about some of the bullying that has taken place in the last week and a half. I do know that many of you are concerned for the welfare of your students, your children, and we appreciate that. I do not know who has done some of the very negative bullying, but it has occurred. I'm sure Dustin and Jared and Bill would never have supported that kind of behavior. I know none of us feel that we want to be bullied into changing our decision. And I do appreciate the respect that all of you who have spoken tonight gave the board and everybody else. You were all very respectful. You presented your opinions thoughtfully and succinctly, and we appreciate that. And now we have the duty of trying to decide how best to do this. We do understand more than we did a week and a half ago the depth of your feelings. I don't think we quite realized that. And but it is something, again, so we have to consider, as I posed the two questions right in the beginning of the question, who should decide what is safest? We have some students who have health conditions and other things. How do we ensure that all students are protected? I heard a lot of comments about not masking and how masks, there are some questions about its effectiveness. We did not hear any suggestions about how to make things safe for everybody. If we do adopt an optional policy about masking, it then becomes your responsibility for the students to protect yourselves and your classmates. It becomes the responsibility of every parent to accept some of the responsibility for making sure that all students are kept safe. That's why we adopted the policy we did a week and a half ago. We wanted to make sure the students were safe. So if we change tonight, we shift that responsibility onto you, who obviously are more than willing to take that. And we appreciate that, because that will be important so that things do not get bad and that we do not have to close the school down. Does anyone else on the board have comments? You'll have to
I got a
lean into
couple.
it, Mike. Get close and speak. Yeah.
Yeah?
Yeah.
Yeah. A couple of people quoted the CDC, so I'm on the CDC website. They made reference to they don't see any benefit in masks, quoting the CDC. So I'm quoting here, at least 10 studies have confirmed the benefit of universal masking in community-level analysis in a unified hospital system in German City, 2 U.S. states, a panel of 15 states in Washington, D.C., as well as both Canada and the U.S. nationally. Each analysis demonstrated that following directives from organizational and political leadership for universal masking, new infections fell significantly. 2 of these studies, and an additional analysis of data from 200 countries that include the U.S., also demonstrated reductions in mortality. Another 10-site study showed reductions in hospitalization growth rates following mask mandate implementation. So that's from the CDC. Just as a side note, the Russ County positivity rate is now 15.3, and we had 21 new cases as between Friday and today.
Anyone else? Jeff?
Just to kind of follow up on what you were saying, Todd, about, as everybody probably knows, I voted for mask optional at the last meeting, and I still believe that. But I will say this, as somebody who's got a child in this, the one thing I'm going to tell her, if we were to adopt this, if this does pass, that it is very important when she goes to the school, and if some other child is wearing a mask, they respect her. I know it goes on that people that, if somebody comes to a school, they may be harassed, and you guys out there got to be good leaders and make sure that they're respected. We wouldn't make fun of somebody if they were handicapped and they were riding in a wheelchair. It's the same thing with the mask. They may have to have that on. And we as parents need to encourage all of their kids to make sure they respect people that have a mask on. And then we can make. I'm just saying, I'm just trying to ensure that the child that comes that does want to wear a mask is respected. And we need to. So.
I'll go ahead and add to that good comment, Jeff. First, I heard some noise after Mike mentioned about our Russ County numbers. And so I looked up, and sorry, Mike, but I think you were looking at the numbers that came out Friday. That was the Monday through Friday number was 21. And it looked like, fortunately, and good news, we did only have 4 new cases between, I don't know if they count Friday or Saturday exactly, but I think it's 3 days, in 3 days, however they count.
I was listening to Bob on the way over.
Yeah. Well, this number would have
So
just
if Bob
come
says
out,
it, it's got to be right.
this afternoon. The new number for the weekend didn't come out till this afternoon. And I wanted to just reflect a little bit back over the last couple of weeks. You know, we've been accused of many things, a ridiculous decision, not caring. I won't go on and on, but I really believe we all do deeply care about the kids. Yes, we might be much more out of touch than a lot of people in this room, and we're not with you every day. But we do care. We do believe that the CDC is our one trusted agency, and as elected officials, the CDC and the Department of Health is really who we have to look to. It's the organizations that, you know, they're funded with our taxpayers' money, and all my life, I'm almost 60 years old, you know, they've been trusted upon for this type of information. So until we have another trusted source that's going to review all studies, you know, weed out ones that maybe were not peer reviewed or for whatever reason aren't reliable, and then kind of, you know, shrink that all down, because none of us has the time to do all that. That's why we pay all them to do that. So unless or until there's another, you know, agency like that is our trusted source, we as elected officials, many of us felt that we need to follow that information. That's the best information we have. So it was with that in mind. It was also in mind of the numbers here locally, you know, really on a steep incline that had us very concerned. And then, as Jeff pointed out, we were very concerned about students that cannot wear masks for whatever reason. It could be a physical problem, anxiety, who knows, that if they are in a building where almost everyone has a mask, then that protects them. So that was a big goal of ours with our policy, as well as just simplifying things, because for teachers to know what all the parents' wishes are and then to try to support them in that, we thought would be very difficult, you know, with all the other demands that we place on our terrific teachers. So that was another thing that really weighed heavily, I know, in my mind, of just trying to have a simple and safe plan for everybody to abide by. I am concerned about that fact. I'm afraid still for parents that might really want their kids to be in an environment, you know, where people are masked and want their kids kind of supported in that. I'm a little concerned that we might not be meeting a need and for sure providing a safe place for all students, no matter what accommodations. And we do have a responsibility for that. I've thought long and hard about our responsibility. And, you know, we are responsible to our voters, for sure. But we are also responsible to have, you know, to try and create really the best district possible, to do whatever we can, I mean, to support, you know, our district in being successful and fulfilling its mission of educating the students and also providing a safe place for all students. So those are just some thoughts for everyone to hear about our thought processes. Thank you.
Any other comments?
Just one other comment. There's probably, I don't know, 150 people here, whole bunch of students, which I think is great. But we have 700 and some kids in the district, probably 12 or 1,300 caregivers, parents, responsible adults. So this is by far not a cross section of our district.
It is true that everyone was invited, but as I did point out, I have had communications from several people saying they were essentially afraid to come because of bullying that has taken place. So that's what was reported to me. So now
I think we can see how the majority feels, but it is true that we've all heard from people that have thanked us. But I mean, of course, it's going to be more natural for someone who agrees with my vote to maybe reach out to me than someone else. So I get that. But we have heard from, I personally have heard from staff, community members, and parents that, not any students, I have not heard from students, but that thanked me and were in agreement with the board's vote. So we may be a minority, but these people are part of our school community.
Okay, any other comments from the board members? If not, it's probably time to take a vote. If you would like to make a comment when you vote, you may. We'll give you time. So, Carissa, call the roll.
Jeff? Melissa?
Before I say aye, I just want to reiterate, can you hear me? I just want to reiterate what Jeff said. The kids that are here, I'm looking at you because you guys are here, and you need to be the role models as you are right now, sitting in this room, speaking for your classmates. You need to be the role models. You need to encourage your friends who are afraid to wear a mask if that's what their parents are asking them. You need to be respectful and kind at all times to anybody, staff, students, okay? It's important. If you're gonna sit here and ask us to do something for you, it's important that you guys understand that you need to be a role model. And with that, I say aye.
Colleen?
I too have been contacted by 30 people, 30 sets of parents and non-parents in the area who have thanked me for voting for masks.
because we do know that scientifically and medically, even though there is disagreement among you, masks are a big hindrance in contracting the COVID. And in my heart, in my deep heart, I am representing first the children. The youngest cannot be vaccinated all the way up to age 12. Are we really protecting them all the way? Don't we want to protect them all the way? I vote no.
Mike?
I agree with the student body president that you guys are all coming into adulthood. And you're going to have to make hard decisions on your own really, really quickly. I agree with Colleen, though, that there's so many people in this district that cannot get a vaccine, and that wearing a mask actually says something about caring about them, because there is a fair amount of evidence that it does help. And for those people that cannot wear a mask, can't get vaccinated, I think we're doing a disservice to them. I vote no.
So are you voting aye or nay? It's no.
Well, I don't feel like we made a mistake a week and a half ago. I guess especially with the information that we had, and I feel like want to change my vote, but I want to say that it's almost under protest. I'm kind of disappointed with some of the threats that have been thrown out there of things that people could do to damage our district. And that has been really scary to me. But it's not just because of that. I also want to vote in unity with our district to make our district strong. So I will ask everyone to really take this seriously. As much as we held opinions, I think many of you also hold strong opinions that may have you a little bit locked and not looking at all the data that's out there and all the recommendations. And I would like to see, especially if things do get worse, and hopefully they don't. Remember, we all wanted to be wrong. We all wanted this thing to just go away so that we could all take off our masks, you know? So if we end up being proved wrong and no one's in any danger, believe me, we'll all be the happiest people. We don't mind being wrong in this case. But I'd like to just beg people to really think long and hard, you know, all the students and all the parents, of what really is the best course of action here to keep yourself safe, each other safe, the people in your homes, maybe grandparents, and anybody that could possibly, you know, be affected by you carrying a virus home. And sorry that got so long, but I'm going to vote yes. Oh, I'm sorry, Gerard.
Well, Carissa, I thank you very much. I'm surprised. I'm impressed. I vote yes too. And I would also like to thank Carissa. She went out of what she was thinking, and I believe very much that she listened to whoever spoke, for or against. And like I've told people before, I enjoy being on the school board, and I still do. And I can't say if we're right or wrong, but we just gotta take the toll and see where it goes. Thanks.
And I guess that leaves me. Even though, for those of you who can count, and since you all, many of you are either students of the Ladysmith School District, or many of you actually went here, Rachel. Don't worry, Rachel, I still have that picture of you and Jamie. I can blackmail you. Last day of class. As many of you know, I have been fighting cancer for the last 9 years. I've had 3 major surgeries, and I am scared of the Delta virus if it gets here. I'm worried what it might do to our community, to our schools, to our students. But at the same time, it's so important that the school district work together, because these are all of our students. We are responsible for all of them, not just the ones that live in our house, but all of them. We are a community. And basically, as far as this motion, I hope it's the right thing. I pray it's the right thing. I'm scared to death we might be making a mistake. But as I said, I hope we are not. It does provide for quick changes if need be, and I hope we never have to make them. I want to thank all of you who spoke. I want to thank all of you who came here. I want to thank those who have attended other board members or board meetings. Those who are on the task force and contributed their thoughts and ideas. Mrs. Stunkel listened to you. She came up with an excellent plan. Obviously, there were many of us on the board that had worries about the Delta virus. Numbers were going up all over the country, and they're going up in Wisconsin. So we were worried. We took what we thought was a safer step. But, as I said, to maintain unity in the district, to keep us working together towards the same goal instead of against each other, instead of splitting the community, I do trust that you will take the recommendations in this motion and wear a mask whenever possible, that those of you who are eligible will get vaccinated. And with that, I too will vote aye. So the motion carries. I really hope when you students come to school tomorrow that you have masks on and that you will show your leadership and responsibility. As Representative Edming, who pushed the civics test that you have to pass in order to graduate, he wanted to make sure that our citizens of the future knew the background of this country, knew their rights and responsibilities, and would take them seriously. So you now have expressed your opinions, you have voiced them, and we have listened. Take it responsibly. Good luck to all of you. Thank you. Motion to adjourn. No, you don't need to worry about that.
All right, I'll make a motion to adjourn.
We have a motion to adjourn.
Second.
We have a second. All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you all for coming.